If you do not pass stool for 2 days, you will still survive. But if you don't pass urine for 2 days, you will have emergency. The fear needs to be removed from the mind.
So most of us think that tomatoes are not good for your kidneys.
Enemy is NSAID painkiller.
So before we dive into some serious stuff, tell us something about yourself. So you always wanted to be a nephrologist, or you had some other plans anytime?
I always wanted to be a doctor, and my grandmother died of some gastric disease, and my grandmother wanted me to be a doctor. And initially I wanted to be a gastroenterologist, but after joining to PJ Chandigarh, I somehow liked the liking for nephrology.
So I think kidneys are the silent life-saving heroes. I mean, they work so silently and do so many things day in and day out.
Kidney removes all the metabolic end product of our body through the urine. If you do not pass stool for 2 days, you will still survive. But if you don't pass urine for 2 days, you will have emergency. And beyond few more days, one will not survive.
But don't you think, most of us, we tend to ignore our kidneys or kidney health until they really trouble us, and because they work so silently and most of the diseases are so silent.
Absolutely. See, if you have a chest pain, you could directly go to a cardiologist. If you have a stomach pain, you go to a gastroenterologist. If you have a breathlessness, you go to pulmonologist. But for what symptom you will go to nephrologist? Because there is no kidney specific symptom. That is the reason that the disease is often diagnosed late, because there is no specific symptom related to the kidney. But mind that about as high as 10% of all high blood pressure patients can have kidney disease. Another early symptom is swelling of feet or face. Another important symptom which is also often ignored is nocturia. Nocturia means passing of more amount of urine in the night. In kidney disease, the urine volume will be normal to high, but person will pass multiple times in the night because of urinary concentrating defect.
So now let's talk about the big word, that is kidney transplant, because most of us, I don't think we understand.
So kidney replacement treatment can be lifelong dialysis or a kidney transplantation. Now these two treatments are interchangeable, and when the person has a below 15 GFR and symptoms, kidney transplantation is performed. We generally do not remove the kidneys from the patient who is suffering from kidney disease. With rare exception, their native kidney is removed. We put a new kidney to the patient from a donor. The donor can be either live donor, which can be related or unrelated, or donor can be disease donor.
So I think life after transplant, that is so changing, and that will be so beautiful. I think that we cannot measure.
Definitely. So your movement, activity will be much better. You will be free. You will be near normal in a successful transplant as compared to hemodialysis or even peritoneal dialysis. The only precaution one need to take after transplantation beyond the time, like beyond 3 months or 6 months, is that take precautions to prevent viral infections or fungal infections. Apart from that if the person's creatinine is normal, the dietary restriction will be much less, and their body will be having more energy, and they will have a freedom for doing anything.
So what are some common myths that you come across every day about kidney transplant that you would like to clear for all of us today?
Every patient is different. The outcome differs from patient to patient and time to time. 1 decade back, what was the outcome in transplantation? Now the outcome is much better, because your understanding getting better to prevent the rejection and also to prevent the infections. So the fear needs to be removed from the mind. But as I say again, the selection of recipient is important.
Now let's have a quick rapid fire round. So what do kidneys love the most? Water, coconut water, or coffee?
Yeah, I think everything needs to be done in optimum. So optimum water intake, not too much, not too less, is the best.
And who's the worst enemy for kidney, sugar or blood pressure high?
Both. You need to control them with optimum drug. There are many drugs available to control the sugar or blood pressure. Here I would say the most enemy is NSAID painkiller. Over-the-counter medicine is one of the most culprit for the kidney.
So most of us think that tomatoes are not good for your kidneys. Is that true or false?
Not at all. I remember one joke the famous nephrologist Dr. M.K. Mani told in a lecture. He said that I don't know what the tomato industry has done to the common people that they have gone against so much to tomato. It is not true. Tomato seeds only. Only risky for people who have a kidney stones because it is more rich in oxalate.
So what are some secrets that you would like to reveal that you follow secretly for a good kidney health?
Never stay in thirst. Your thirst will decide whether you are dehydrated or not. Excessive water intake is not good. It may cause a low sodium level or even it can increase the blood pressure. Moderate amount of water intake for an average weight of 70 kg, 2 to 2.5 liter of water intake per day is enough. But if you are doing exercise, if you are in a hot weather, if you are hypercatabolic, then you need to take more water. The other thing is that your weight, even morbid obesity is one of the very important risk factors of kidney disease. Control your weight, control your sugar, control your blood pressure, have a healthy diet. That's very important. These are the tips to keep your kidneys health. And above all, you need to do a screening. If you are above 40, I would recommend you to do once in a year estimating your serum creatinine, your routine urine examination, and once in a year do ultrasound kidneys and bladder.
So by this, do you secretly judge people who say, I hardly drink water in a day?
Yeah, there are people who takes less water. That should not be done. Only tips is that don't stay on thirst. You should drink about 8 cups of water per day.
How about people who just juggle down 1 to 3 liters of water every morning they wake up? Is that a healthy habit?
No, this is a myth. This may lead to severe hyponatremia. As I told earlier, it may cause rise in blood pressure, volume overload. It's not a good thing to do.
Another common myth, doctor, we hear is protein powder. Is it good for kidney health?
This is a very interesting question, which even troubles me also. The average Indian protein intake is definitely low. So the issue is that whether we should take the commercially available protein powder or not. My son insists me that I should take it. I have not yet started, but I'm seriously thinking to take it. Because our protein intake is so less, some amount of protein supplementation in the form of a powder can be recommended. But this area is not yet settled. What I would recommend you, please take about 0.8 to 1 gram per kg of your body weight of protein per day. If you are unable to make up this protein in your diet, then the rest of the amount has to be supplemented with the protein supplements.
And finally, if kidneys could talk, what do you think they would be telling us?
Well, they will probably tell us that I am doing very important work. Please take care of me.
And I will take care of you.
So that I will take care of you.
So I think we all can survive without pizzas for a couple of weeks, but not without our kidneys even for a minute.
Absolutely.
So it's important to take care of our kidneys, have enough water and go for regular checkups. And we should not wait for the kidneys to give up a resignation letter, isn't it?
Sure. And I tell you, moderation is most important. We human beings need to enjoy our life, certainly. So indulge in bad foods, but do it infrequently. Keep a watch on our body weight, on our blood pressure, on our sugar, and go to doctors for a routine health checkup even if you are not having any disease.
So thank you, doctor. It was wonderful interacting with you, and thank you for such an important discussion we had today about our kidneys.
My pleasure. Thank you very much.